All right, Stephanie. So having just looked in your mouth and checked out your x-rays earlier and having had our hygienist talk with you a little bit as well, it looks like you do have a couple cavities, which isn't the end of the world. And I would just love to talk through what options we might have for helping you with those and kind of seeing what might be most important to you in terms of choosing an option. Okay?
Okay.
Perfect. So the kind of cavities that we see are kind of on the bottom of your tooth. You may have seen them, and they're kind of some little darker spots right along your gum line.
Mm-hmm.
And there's a couple different options that we could do here. The first option you're probably pretty familiar with. It's a filling. The second option is a newer option that involves not having to drill into your tooth, not have to get a shot, anesthetic, things like that. We put this liquid on your teeth. It's called silver diamine fluoride. So painless, easy to do, fast. The negative is it does turn those areas dark. So we could do that and put a filling over the top of them eventually, or we could just leave them like that. They're pretty far back there, so you may or may not see them. But if it was a big deal to you, we could, put something over the top of them that makes them look a little bit better as well.
Okay.
So those would kind of be our two big options. You always have the option to do nothing. We generally don't recommend that because it tends to get worse, right? It's not probably going to stop by itself. But we always want to make sure that you don't have to receive treatment if you don't want to. But generally, those first two options, if you want to stop those cavities, are your choices. So
Okay.
I wonder what you're thinking. What's most important to you when you think about the options that you have?
I guess more so I just don't want to have to pay out of pocket. Will my insurance cover it?
Okay. It's a great question. So the insurance covers the fillings. Unfortunately, insurance doesn't cover the second option, the silver diamine fluoride right now. But if it's okay with you, maybe I can kind of talk a little bit about cost benefit of some of those things in the long term.
Sure, absolutely.
Okay. So insurance does cover the fillings right now. But once we cut into your tooth, generally we know that we have to replace those fillings over the long term. And, eventually those fillings get bigger and it can cause, crowns, eventually, or root canals or something like that. So the long-term cost of doing a filling is probably higher. If we can avoid cutting your teeth and keeping as much of that natural tooth structure there as possible, it tends to, be more beneficial for you in the long term. So even though you might pay a little bit now, you'll probably avoid some cost in the long run. It's kind of like putting new tires on your car, right? If you never put new tires on your car, it's cheap until your car is flaming on the freeway because your tire blew up, right? And then it's really expensive. So it's kind of paying for that prevention up front a little bit, but probably is going to save you money in the long term.
Okay.
It can also help prevent other cavities on other teeth. We've seen that effect as well. And so you might avoid other cavities because of that as well. So thinking through that, I wonder if you have a preference of, maybe pay a little bit more now, but less in the future, or, what's most important to you in terms of that?
I think definitely if I can just pay for it now and avoid future problems, that would probably save me some money down the road.
Okay. So it's important to you to save that money, but you're willing to pay some right now, and then, avoid those problems. That's important to you as well.
Yes.
Okay. Perfect. Well, yeah, we'd be happy to take care of that for you then. We'd be happy to do that silver diamine fluoride. We can do it starting today. And then if you want to maybe come back in 2 weeks, we put it on again. And that really shows that most of those cavities do tend to stop at that point. So
That sounds great.
perfect. Well, we can get started and it should be good to go.
Great.
Awesome. Thanks.